This conference will now be recorded.
So these calls, Workforce Wednesdays, are calls that we have been holding monthly as a place to share practices, ideas, solutions around supporting and building a strong workforce. And that is even more important now than it was a few months ago with all that our teams are dealing with. And we're so glad to have with us today Nate Hamme, and Nate is with the Ceca Foundation in Washington, D.C. And he's joining us to share some practical thoughts on how we can continue to engage and recognize our teams during this time of coronavirus. So thank you so much for joining us, Nate.
Thank you very much. Appreciate you having me.
Great, go ahead and take it away. We can see your screen, so I think we are all set.
All righty. Well, I thank everybody for joining. I know people are especially busy these days, and I just was really excited to get a chance through LeadingAge Maryland and LeadingAge National to talk a little bit about the work that we do at Ceca Foundation, but more broadly, just talk about the things that we've learned over time. And so I'll give you some background later on in the meeting about Ceca and our Ceca Award program. But my focus here really is going to be on doing some educational updates on research, and especially things that we've found effective that organizations can implement when we're in such a challenging time, one that requires social distancing and sort of creativity around finding ways and times to recognize our staff for the exceptional work they're doing. So again, my name is Nate Hamme. I'm president of Ceca Foundation, and our mission is to improve the human experience in healthcare communities by honoring the work of exceptional caregivers. The work that is being done in our nation's skilled nursing, assisted living, senior living communities is more important than ever. I think people have all come around realizing that. And this is something we've been very passionate about since our founding in 2013. And so hopefully I'll be able to give you some actionable items here, things that you can do day in and day out to help engage and recognize your workforce. And then again, I'm very excited to have questions and even comments at the end of the presentation, things that you might be doing that you've found exceptional in trying to honor the staff members who come in there every day, protecting the community, your residents, and working for those families. So the goals of the session here are sort of, I've got 4 laid out. So one is understanding employee engagement in its current state and the value of prioritizing efforts right now in healthcare organizations. Our focus is frequently on recognition, but ultimately the goals are more around engaging your staff and making sure that they feel connected to the work that they're doing day in and day out. So I'm going to do a brief overview of something you may have heard in other educational sessions, Maslow's hierarchy of needs. I'll go through that quickly just to help explain a little bit about why we do the things we do and how especially effective they can be when you sort of keep that framework in mind. Also, learning best practices in employee recognition, ultimately how that recognition drives engagement and impacts the patient or resident care within your organizations. Increasingly, I think we all understand that we're more than just care centers, care communities, but we have a level of service. We're service industry folks as well. So a little bit of discussion there. And then lastly, how organizations can implement some of these types of initiatives during COVID-19 and really impact key engagement and retention benchmarks, and even beyond that, organizational goals. So I'll jump in here. So I've tried to put together a concise definition of employee engagement, and there's a lot of it floating around, but basically the idea is that you want your staff to be willing to go above and beyond without being asked to do so. Engaged employees view their work as a calling. They feel a sense of belonging at the organization they work for, and they provide maximum effort to see the company succeed. So I think there's a part of me that has always felt healthcare has some built-in advantages here, caring for others, serving your community. The folks that come to work for you day in and day out are really looking to serve. So you've got people who are passionate and driven, and that's a great start. But as you'll see in this upcoming slide, we've also seen that there are some limitations and some real challenges ultimately out there in the real world. And there's been a lot of research that reflects this. And I think what I would love to help to do, and I think all of the organizations are working towards, is finding a way to change the current situation to something a little bit better, and one that better suits the stakeholders within our organizations. So I'm going to do just a quick sort of contrast between the current state of healthcare engagement and the ideal state. Unfortunately, the healthcare industry, when compared to all other sorts of industries across the economy, is ranked at the very bottom when it comes to employee engagement, with only about a fifth of employees saying that they are very engaged in their work, and the same amount saying that their managers or leadership are quote unquote horrible at recognizing them. So that's disturbing, and I know is not befitting the work that's being done on the ground. So maybe it's just a change in tactics or strategy here that we need to be looking at. Overall, across industries, the number one reason Americans leave their jobs is that they don't feel appreciated for the work they're doing. Now, you sit there and think, gosh, people coming in and caring for patients, families, residents in our organizations, how could they not feel appreciated because they get to see the fruits of their labor every day? But that's the reality of what we're seeing. And as a result, you see a 70% burnout rate among nurses, and 44% of those same nurses worry that their patient care, basically the service elements of their job, will suffer because of that burnout. Clearly, if you're going home at the end of the day and just feeling like you can't take it anymore, that also bleeds into your personal life, and it becomes sort of a terrible cycle of just feeling down about what you're doing. And ultimately, I think there's a real opportunity to connect one another to all of the really terrific work and the difference that's being made in the industry. So the ideal state, on the other hand, is that recognition, along with career opportunities and the reputation of your organization, are top drivers of increasing that engagement level. So we'll go through some strategies on how that can be assisted. Ultimately, companies save money by reducing turnover, which LeadingAge actually has put out a research report on this in the past, that every time you lose a staff member, on average, it costs about 25% of their annual salary to rehire, replace, retrain somebody new. And then you also lose some consistency there with your organizational culture. And that's going to be a main theme of what I'd like to talk about in the upcoming slides. In addition to just having happier employees, engagement directly correlates with patient safety, resident safety, quality, and patient experience outcomes. And clearly, within the regulatory environment, patient experience is something that's a little bit hard to define, but they've been making their best stab at it. How can we find out how people felt about their experience in a community through a survey or some sort of assessment? So those have both organizational objectives in mind and financial objectives. And then lastly, investment in recognition and engagement. When companies contribute or spend about a 1% or more of their payroll on recognition, 85% see a positive impact on engagement. And I think that's an underlying theme here, is just the cost effectiveness of spending that little extra money in what you get on the other side. So again, hopefully all of this stuff you can say, okay, these are fairly easy ways for me to do something that really makes a big difference, and it's not going to blow a line item in my budget. Ultimately, it makes sense, dollars and cents here for you. So I've mentioned Maslow's hierarchy of needs, and this is somewhat academic, so I don't want to belabor the point here, but basically the concept is that people have certain things that they need to survive, and then others that they really need to thrive. So at the very bottom of the pyramid, what you need is the basic necessities, a roof over your head, clothes. So a job is something that provides you money, income, and that will allow you to meet those basic needs that you want when you leave the building. But Moreover, and if you're looking to really create a culture that is befitting of your organization's brand, what you're looking for is ways to connect people with more than just a job. You want them to think of this as a career, something they want to start in and continue in medium, long term, something they enjoy doing. And then the ultimate goal is that your employees look at what they do as a calling, that they are serving people and that they're seeing the results of what they do every day. So, you've got your people who come in for a paycheck, and certainly you may need some of those. But ultimately, what you're striving for is loyalty to your organization because they feel appreciated for it, and then a connection to the work itself, being inspired coming in every day and knowing that you can make a big difference here. So Maslow's hierarchy pyramid is on one side. For the employees, you can sort of see how that is translated into more actionable things and an environment that you want to be able to create. So this is something I think we can contextually look back to for all of the forthcoming information, because it really is about creating a culture and some way that your staff can feel connected to the work that's being done and really strive for your organization to succeed. What drives employee engagement, I think, is the big overarching question. What do you want to be investing your time and resources in doing? And you can see here, the research is a little bit old, but actually has been followed up more recently, and all of the findings sort of align. Employee recognition is maybe the best way to continue to engage your employees on an ongoing basis. We've seen so many organizations that come up with some great ideas on how they can recognize their employees, but this is not something that starts and stops with kicking off an initiative. It's something that really needs to be lived day in and day out, and that's where the cultural element of this comes in. You can see cultural values sort of separately, but very much intertwined in my mind here. That's another important one. And then you've got interactions with your direct manager, which I think is sort of a great opportunity when you look at your organizational structure to say a great way to enhance that reputation, that relationship that one has with their manager, is by having a positive feedback mechanism that the managers can use to sort of reward and reinforce some of the ideas, some of the values of the organization. And then lastly, surprisingly, in some ways, work-life balance is not viewed as highly as either of the other three. Clearly important, and that's one that in some ways can be beyond your control. But there may be some strategies when you're talking about hiring and onboarding employees that you may be able to use that can impact that work-life balance portion of this in terms of just finding the right fit for your organization. So research shows that the organizations with recognition programs that are highly effective at this will see lower turnover by about a third. So you can imagine how much that makes an impact on the bottom line. And again, for me, there's the bottom line, which is ultimately important. But when you're a people person, this is also about making happy staff members, making happy consumers of your service. So that will allow for a continuity of employment that really makes the cultural building elements of what you're trying to do all that much easier. So again, you look at it from a financial and sort of a business goals standpoint, but for me, the human element is really what allows that to happen. So that's something we're going to be working towards here in all of these different best practices I'm about to go over. One last just quick metric slide, and then I'll move on. Social recognition. This is something that people may not be as familiar with, and we'll get into some of the technology stuff a little bit later here, but social recognition sort of is beyond just going up to somebody and thanking them for something that they did or work that they're doing. It's finding a way to make things more public, and in particular, this can be facilitated with technology and social media. You've got as just one easy to understand example, ways that you can share that recognition to a broader audience, and that has very beneficial impacts on engagement and productivity, retention, et cetera. And then you can see the greatest impact on employee engagement is through recognition, and then some of the things that you might expect to be even higher on this list are rated below employee recognition, such as sort of financial perks, and other wellness initiatives, which are very important, and I want to talk a little bit about because I think they provide opportunities, particularly in the current environment, creative things that you can do that help you get towards that ideal state of engagement within your facility. And then the business impact of social recognition. Again, if you're publicly traded, that's one thing. We are really focused on nonprofit organizations, but you need to be able to pay the bills. And so all of these things make real, if you're having to sell this to somebody who's more on that side of the business, this makes sense from a financial standpoint, and not just feel good stuff, which I think is the fun part for most of us. So one last I want to tie the logical thread together here. So you see that recognition is an important part of driving engagement, and engaged employees become more loyal to your organization. Particularly in long-term care facilities, there are really substantial opportunities for relationship building with residents and family members. Again, this is not transactional like it would be in an acute care or hospital environment. Relationships are built every day, and ones that are nurtured every day stand the test of time. So really, if you can recognize your employees and engage them in creative ways, you're going to get better care. And this has been borne out by many different research studies. Employees are more productive, they put a greater emphasis on safety, and you see some of the healthcare metrics here: satisfaction scores, readmission rates, ulcers, patient fall rates. All of these things have been highly correlated with engagement. In fact, more highly correlated with engagement than staffing numbers, the number of people per resident that you have, on duty. So this stuff really makes a difference there. And again, we can see how organizations, there's a compelling case to be made if you're trying to come up with an initiative or a reasoning for doing something a little bit different, or spending a little bit more. Then this stuff really does help to make organizations thrive. Okay, laying the foundation for employee engagement. So I know everybody has probably got an onboarding process, a hiring process that's particularly well defined within your organization. But some of the things that you're going to want to look to do is you don't just want to hire the most competent people, but you want to find the ones that fit your organizational culture and then train them in that culture. You want to make sure that they feel a connection to how you do business, what makes you special. If they feel like you are different from all the others, then from a competitive positioning, you're going to be able to bring in the right people, and they're going to want to be working for you as an employer of choice. You can do that by making sure that the staff feels respected and appreciated through recognition, through other initiatives that emphasize the difference that's being made, the work that's being done day in and day out. There's also something that needs to be done from a management leadership perspective, which is empowering those same individuals to provide feedback and help the organization improve. Asking for feedback from the staff is a double-edged sword. You want to be able to feel like they have a voice, but it also means that you need to be able to do something about it. If it's falling on deaf ears, people will know, they understand if they're being just told something and nobody's walking the walk. So empowering people is incredibly important as well. This is what's going to help you retain your best and most productive employees. In the HR field, I know there's such thing as good turnover and bad turnover, and clearly there are some people who just, for whatever reason, don't end up being the right fit. But through recognition, you can make sure that you're the most efficient, productive, the ones that fit your environment, your culture the best, are the ones that stick around. And then lastly, again, what we're all striving towards is providing highest quality of care and experience at your community. And that's going to be a very highly correlated effect with some of these previous ones that we're laying out here. So when we're talking about recruitment, hiring, and onboarding, I wanted to mention just a few things. In the recruitment field, one of the best things that you can do is communicate clearly and have a simplified process for people who say, I would like to work for this person. If you make it hard to apply, or you don't clearly communicate timelines or expectations about when you might hear back, people get a little disassociated from what's being done. They lose track of you. They feel like, oh, maybe I'm not going to get this one. And then they even if they are offered a position, they may feel like, well, they're not communicating well now. How are they going to communicate when I'm, on the staff, part of the work they're doing? This is setting expectations early on, and it makes a big difference. And particularly during this time where a lot of in-person interviewing during this process is not really feasible, there's a need to sort of account for technological challenges. So we're all getting much more used to using things like GoToMeeting here, Zoom, Microsoft Teams maybe. Not everybody's going to have access to that. And one of the things that we've found is that people are now, I think since 2012, more likely to have access to a smartphone than a PC. And so you're going to have to sort of take into account the technological capabilities and abilities of those who you're interviewing for positions. So again, making sure that you account for those things will go a long way if you decide to bring somebody on board. From day one, you need to define the expectations of the position that people are being brought into. So if it's not clear what their job description is and what their day-to-day life is going to be like working for you, then you're setting yourself up for failure. So one of the great ways to sort of define that for these folks early is that if you can find a buddy or somebody that you inherently or in particular trust to be an ambassador for you, it's a great way to set up a buddy or a mentorship that helps them thrive and grow in the organization. And as a running theme here, the culture of the organization, what makes you special, your values and how you live them day in and day out. If you can continue to pound that home, make sure folks are feeling that connection and seeing it as it bears out in the real world, that's going to have off the jump, you're going to be in good shape. But clearly it doesn't end there. It provides you an opportunity early on to get people's first impressions. So feedback that is without bias and just very fresh for people. So you can use your supervisors in asking for that feedback. There's a good opportunity to set up a regular flow for professional development type meetings, as well as asking those questions about, hey, what are we doing really well? What are we not doing really well? If you can get that routine early on, it makes it much easier to stick with. People inherently expect to be able to do it, and then it just becomes part of who you are. And then with recognition, the studies suggest that you really actually want to be recognizing your staff every week, if possible, every 7 days. But within the first 90 days, it's actually especially important that you have a consistent positive feedback loop. What people are doing right. They're not going to be perfect from the get-go, but if you can tell them the things that they're doing well and help build that confidence in you and the organization, it's going to encourage positive behaviors, and you'll see more and more of them. Other opportunities for employee engagements. This is one that I added recently because I saw a very interesting article about what creative ways hospitals and skilled nursing facilities, as well as other organizations, are identifying the needs of their employees during the pandemic, sometimes even before they realized they needed them. One is nutrition. So there's an opportunity here, if you have a way of doing community outreach to local businesses, to offer things like on-site meal options and snacks that don't require people to leave the building, which can add to the safety element of what you're doing, and it makes them feel like they're appreciated, just giving them things. There are some organizations that I've seen recently who will sort of match 50-50 if you purchase some number of pizzas or sandwiches, that they will help you with it because of the work that you're doing, knowing it's so essential. And so there may be some places around you that you can find who are willing to sort of work with you, make this a lot more doable from a financial standpoint. On the housing side, some of you may be having some of these challenges, others may not. But if you have staff who do not live close by or live with a potentially a vulnerable family member, you may be able to give people options for ways that they may be able to stay somewhere closer to their employer through a hotel, an Airbnb, or other providers to eliminate that long commute, or say you're waiting for the results of a 24-hour test. We put you up for the night so you don't have to feel bad about going home and sneaking around and making sure that you don't bother anybody or compromise anyone. Lastly, mental wellness and burnout mitigation. So a lot of organizations have found ways to do regular, weekly, or at least monthly sessions, things like counseling or meditation that have been proven to enhance people's mental well-being. And moreover, for just having forums for sharing people's thoughts and anxieties and concerns during a time where I think we're all a little unsettled. We're all going through these same challenges, and having an opportunity to talk about it. Clearly, there are other things that you can do, and some organizations are able to bring in, massages or personal care type of providers who are happy to reach out to the community and try to do something good during this time. But again, thinking about the employees first and their mental wellness, I think, is really a great thing to do. Best practices for employee recognition. So this is getting a little bit more into the thick of what Ceca does, but recognition should be a number of things. One, crafted around your culture and values. And that means really including your executive team in the process. It's very clear when leadership stands behind you and when they're just sort of in the background, not paying attention. So if you can have a leadership team, particularly the top person or the top people in the organization involved, that's going to make it more meaningful. If it's done in a timely fashion, people aren't going to forget about what they did that was being lauded, and it really will encourage that behavior. If you make it public and flexible to include participation for remote staff, residents, guests, maybe you have somebody who submitted a nomination who's a family member. This is a way to make it extra special for them. And that's why we talk about at Ceca 360-degree recognition or multidirectional. So it's not only on the leadership team or the managers to be submitting these type of things. You can have your frontline staff submitting peer recognition, and you can be asking the patients, residents, and families to be doing the same. And then you get everybody, every stakeholder in the community telling you what they've seen that's really meaningful to them. Since you are 24/7, 365 organizations, the night shift is one that gets forgotten about a lot of times. Look for opportunities to honor them. And then you have people in support roles that aren't always visible, that are doing really important work. And I know everybody coming together as a team more than ever now, finding ways to make sure that they're a part of this and not just left out in the cold. Clearly, there are a lot of organizations. I think some of the most popular recognitions are for years of service or birthdays. They're easy ones. They have a date. And supplementing that with things that are more around your culture is certainly a great thing to do. And I think, with regard to technology and millennials in the workforce, doing it in a format that is appealing to perhaps the younger crowd that you're bringing in, and you want to stay with you for more than just a short period. Having that appealing method for doing recognition is something that's going to have benefits down the line. And lastly, you want to be able to thank the people who are thanking others. So having some sort of thing that you give back or incentive for people to tell you the stories that you can use for multiple purposes is going to be important as well. You want them to keep doing it and make this something that they have a routine of doing, thanking one another. Peer recognition, which I mentioned, again, this is going to get you, there are more frontline staff than there are managers and leaders. This is going to get you much more in terms of your ability to see things out on the floor and in behind closed doors, things that are being done. So you can see that peer recognition greatly increases the positive impact on financial results, and companies that use it see huge increases in customer satisfaction, and ultimately that's really what we're striving for. So I'm going to just skip through this one, but you'll be able to see it when we send out the presentation. Here are some easy, affordable ways that you can do this recognition without having to spend a whole bunch of money on doing it. So things that just require time and not necessarily a whole lot of dollars. And one of them at the very end is making recognition accessible through any public channels, social media, newsletters, but also encouraging your managers to share it in staff meetings and huddles. Again, that you get a lot out of that. Instead of just honoring one person every month, you get to hear a lot about this stuff on a consistent basis. Why technology matters, and we're all being sort of pushed into having to do some of this this technological stuff that we're not all necessarily comfortable with, but I think we ultimately need to embrace it. Not only are younger staff members really enthusiastic about being able to use technology, but it provides an opportunity for instant feedback. And so there are a lot of tools out there that, especially during COVID-19, where we're having to social distance, allow for improved impact and just by virtue of using them. So how technology can work for you. There are clearly a lot of benefits, but there are also pitfalls, and you have to weigh both of those and figure out how you're going to do it. Benefits being that there's a central receptacle for some things. You can automate a lot of the processes, you can make things more visible in public. It's remote and sterile. You're not asking people to, all touch a piece of pad of paper and write things down. You may be able to do it just via an email inbox, set up something that's a distribution list, doesn't cost any money, but people then get to see this stuff and they can do it from the comfort of their own homes. And then metric tracking, which is something I'll talk about in a second. Just you want to be able to measure the impact of the things that you're doing. When you launch a new initiative, if you don't know whether it's working, then you're missing half of the battle. Of course, the pitfalls being that some of this requires training depending on how complex the systems are. There's a maintenance and upkeep. You need to have somebody monitoring it, ensuring that it's working. And then there's clearly the monetary aspect of it. There are a lot of potential partners and vendors out there who have great products, but they are not cheap. And so you got to figure out exactly what you can take on. And so right now it's a difficult time to put a huge line item in the budget to figure out what new system you can add to the myriad systems you already got. So in measuring this stuff, surveying employees is obviously the best way to be able to do it. You want feedback from the horse's mouth, and surveying is a great way of finding that feedback. Recommended cycle is every 6 months at least, if not quarterly. So tracking the rate of change is critical. And there are a bunch of different survey and research firms out there like the Advisory Board and Gallup who have different engagement surveys or indexes, but there's so many of them. You can sort of pick and choose what you want. The NPS is another one, the Employee Net Promoter Score, where you ask your staff members whether they would recommend their employer as a facility of choice for your particular service industry. So tracking it and having a system of doing so is going to be critical. So if you're not measuring, you can't determine success, and that's just that's the bottom line. But clearly, there's a touchy-feely aspect to this, and one that's perhaps the most rewarding. You get an idea of some of the award presentations that you can do that really show people, your staff, being able to celebrate together, pat each other on the back, and particularly having a leadership team member there to do the patting in a leadership servitude way makes this even more effective. But I wanted to show you this next one as well. It's not always easy to get groups together in the current environment. What you can see is that there are still ways, even with smaller groups, that you can allow people to see this stuff who can't be in the building, whether it's some people who are in the administrative staff, maybe at a corporate office, or we've had a bunch of really cool celebrations that we've done that included family members of an award recipient or an Employee of the Month style recipient. You can sort of patch them in and have it be a fun thing for them, for their loved ones to be able to share in the event. So all said and done, it may be harder during this time to really share these celebrations, but there are creative ways using technology that you can make sure that all the stakeholders have an opportunity to enjoy and participate in these. I know we're running a little bit long here, so I'm going to go really quickly, just tell you a little bit about Ceca Foundation. So we've been around since 2013, and we are a nonprofit. The impetus for our founding, Matt and Rosemary Lawler sort of had this idea and wanted to honor Matt's mother, Mary, who was in the Women's Army Corps during World War II, and actually, was on the beaches of Omaha a little more than a week after D-Day. And this is a seminal person in his life and in Rosemary's life. And to honor her experience at a military retirement community, Knollwood, I think is a good transition here. So I brought in Juanelle Glossbach. She's a personal friend, I'd like to think now, but she's also somebody who's experienced our program. And I wanted to let her talk just quickly and tell her a couple things. Let her tell you a couple things about about Knollwood and what they've been doing over the years here and even more recently. So, Juanelle, are you there?
I am.
Wonderful. Well, I'll just want to give you a minute or two here. And again, Juanelle has been both an award recipient and somebody who has been a very active supporter in terms of recognizing others at Knollwood. So we're very grateful for her. But I had just two quick questions for you, Juanelle. So one, I wonder if you could share a bit about what Knollwood is doing during this especially challenging time for employee wellness and engagement.
Sure. There are a lot of things that we've done, but I will say three of the most important things I think that we did is that when we first saw the staff after we had a few cases at Knollwood, and we saw the anxiety rise so high with some of our staff working here, afraid to come to work. And so the things that we've done is we've constantly had adequate PPE in stock. We did, not me, but the facility. We did COVID-19 testing beginning in April 14th, and that went. All the staff was tested, and since then we've been tested regularly. And we had the CDC who came in and showed us how to properly, put on, take off the PPE, and we also had staff member training in that. Someone who trained us. We had prayers offered by DON and by other activity staff on the unit. We had yoga nidra, which is something to help. You probably all know what that is. Anyway, it just really helps staff or anyone who does this class, helps them to learn how to use their breathing, to relax, and it helps with their sleeping as well if they do this program. It helps you kind of just unwind, relax. We really did a ton of things. We did just for staff mental health and just help them keep involved and know that, there's other things besides COVID going on. We made sure that they were able to, if they wanted to order food from a bistro, it would be delivered to the unit for them. We ordered several hot meals out to serve. And yes, we didn't forget our night shift. We did each shift. In activities, we used our budget since we didn't have entertainers during this. We used our budget to buy snacks and treats, personal items that staff might need. We did several raffles to present them with these things, and we did Knollwood T-shirts that says Knollwood Strong for staff. Gift bags with personal care items. There's just a ton of things, and there's more, but I won't go on. We also offered our social work setup 3 large screen TVs so that for our staff who we lost and our residents who we lost due to COVID, we were able to watch memorial services, and we were able to have the hospice to do one of the memorial services for us for our staff and residents. And it's just amazing. We also were able to, Knollwood did hazard pay for staffing during COVID. And kind of that's it. There's more, but that's good enough.
Thank you, Juanelle. That's great. And as a LeadingAge member, I know that Knollwood is, very much has the same values, things that many of the other listeners would have. And just quickly here, as a recipient of one of Ceca's awards and also having received a nominator prize for recognizing others, how did this recognition become meaningful for you, and how have you embraced sort of the opportunity and the challenge of recognizing others?
I personally, when I received the nomination and when I received the award, I was shocked, surprised, thrilled, teary-eyed. I was so honored, and we, as you know, Nate, when we get a little email notice that we've been nominated, and you can go on and see who nominated you and what your coworkers have written about you. It truly, I get teary, it truly touches your heart, and it's so important, and it means so much. It makes your day, and that's just reading the words. That's not even counting when you win and you get the, monetary, just reading the words of what someone thought enough about you to write about you, to nominate you. It's heartwarming and just very touching. And when I nominate others, that makes me even feel better. When I get to hear some kind deed, some act of kindness, and something that is making a really big difference in a resident's life, and I hear the staff members who is providing this or, saying whatever they're saying to this resident that improves their life and makes them feel better, sometimes even just for the moment. And sometimes it has a very long-term effect on the resident. I love it. I love doing that, and I just know that when we do nominate other staff members, I think they feel the same. It's just to read and to know that they were nominated, whether you win, whether you don't, of course they want to win, everyone does, but when you're nominated, I think it brings a closeness between you and that staff member, even that you've nominated, and it touches their hearts, and it's, that's kind of it. It's just a win-win.
Yeah, exactly. I feel very much the same way. Thank you, Wanel, again. We appreciate you so much, and the work you're doing is great. So thank you for joining.
Thank you, Nate.
We've run pretty long here, so I just will sort of wrap up. As an organization here and as a nonprofit, we're out there very happy to sort of help others in the healthcare and senior services field implement and run these effective programs. We have a suite of technology that we've developed over years to be very simple, require minimal training, use mobile apps, uses sort of a TV network that can help make all this recognition more public. So we've done a lot of the investing in making sure we have something that works well for all organizations of all shapes and sizes. And we have a process that works really well in identifying people and honoring people who are deserving and really should be honored more often. So you can see a little bit about the award and the honorees that we select. We have a monthly or quarterly awards depending on the facility we work with. And over the years, we've received about 25,000 nominations and awarded over 1,000 people with, to wit, $250,000 so far given away in awards. So this is something we're really honored to do and will continue doing, and happy to work with folks to do this really effectively. Here are a couple things that we can talk about if anybody has interest in learning our process and things that have worked well for us that also help maintain the program. What we're about is making sure that we are true partners in this endeavor, making it fit and custom to your particular community, but also taking the load off of the shoulders of your staff who are already have a lot of responsibility or stretched thin. We are there to do it. And then we're also there tracking all of the metrics that were mentioned previously, helping you show progress, helping you show that you're making an improvement in the quality of care as well as in the overall efficiency and performance of your organization. And this last slide, again, I'll let you review separately if what's involved in working with us. Again, we're a resource. I'm happy to have conversations with anybody and just talk shop. This is something I love and I'm passionate about. But if you did want to work with Ceca, we fund all of the technology, the marketing and operational support, as well as the financial awards. And we are basically a membership network and we're happy to work with pretty much anybody that would be able to work with LeadingAge, be a LeadingAge member, we would be able to work with. So thank you so much. Again, I know we may not have time for too many questions. I'm happy to answer them, but my contact information is here and we can always take it offline. And thank you all for tuning in, and thank you, Allison, for having me.
Nate, thank you so much for sharing. We did get some questions from folks asking if you can share the slides. So if you're willing to send me any resources or slides, and I know you shared these with me ahead of time, we will make a PDF of those available. And if folks have questions, you can reach out to Nate directly. And Nate and Wanel, thank you so very much for sharing such an important conversation, and we really appreciate you giving of your time today. Thanks, everyone. I hope you have a great rest of the day.